All right, everyone. Well, thank you for coming back, and I want to introduce our next speaker, Andy Link. Mr. Link is currently the Senior Manager for Strategic Partnerships at the Nebraska chapter of the American Cancer Society. Mr. Link is also a member of the cancer support team at ACS, where he aims to ensure that healthcare facilities are aware of all the programs that ACS has available for patients. He ensures partnerships with NCI designated cancer centers, COC accredited systems, VA facilities, and integrated delivery networks and large oncology practices. In addition, Mr. Link provides cancer control consultation services and helps to implement evidence-based strategies through the ACS cancer control programs designed to have broad population impact on reducing cancer incidence and decreasing mortality rates across the state. Welcome, Andy.
Well, thank you. Again, my name is Andy Link. I'm with the American Cancer Society. As Carmen mentioned, my position with the American Cancer Society is more of working with the health systems and the cancer centers across the state. My job has recently expanded to now Iowa, North Dakota, and South Dakota. So I work with those folks at those cancer centers, and I'm more the liaison with those folks as far as the programs and services that we offer at ACS for patients and direct patient care and so forth. And we'll talk a lot about that as we go along. I started back in June of 2019, and as part of my onboarding process, was just learning my accounts, learning the area, learning the systems and so forth. And then as we know, about 8 months later, our world changed. And so with that change, I wasn't able to do things like this at that time. And so now I'm 4 years later, as our programs are coming back, they're operational and so forth. We're able to do things like this and let you folks know about what's available to cancer patients and their families throughout the country, especially here in Nebraska. So I like putting this slide up. I'm a really big advocate when it comes to rural health and it's our state here. It's a little harder to see on the slide on the left, but if you can see the dots, that's the critical access hospitals in Nebraska. And then you can see on the right is the 12 cancer centers here in Nebraska, and they all pretty much follow the I-80 corridor, except for a couple, the one in Norfolk and the one in Scotts Bluff. But what it's just pointing out, there's large voids with healthcare here in Nebraska. Especially when it comes to cancer care. So just pointing that out, just kind of what we try to do here and try to increase our access to care for our patients. I like starting with this slide because this is the place to go for information for ACS. If you need quick information about what programs and services or how to connect programs and services to patients, the 1-800 number listed there is your go-to source. You can be connected to a person right away, 24 hours, 7 days a week, 365. And it's not a recording or anything. You get right to a person and they can help you navigate the system for whatever patient care services are needed for your patient or whatnot. So the cancer.org is also a great website for learning about the different cancers, the different treatments, what kind of they can help you navigate the healthcare system. They can help navigate the insurance system and so forth. So these two places are the go-to source for patient needs and services. And we'll kind of talk about more of these as we go along. These are some of the online communities that we have. We have a Cancer Survivors Network, and you can all, again, be accessed online. We have the Reach to Recovery website and app. So for patients who are currently going through breast cancer and treatment for breast cancer, we have a program called Reach to Recovery. This program is set up with mentors that have gone through, are survivors of breast cancer, and they have volunteered their time to be mentors to folks or women that are going through cancer treatment currently. So it's an online app. Once they fill out their profiles and so forth, then they get connected with a mentor and mentee and so forth. So it's a great program and really successful. Other things for online support pages, we have the survivorship support. The middle column there talks about all the different languages that we have access to for our programs and services, as well online, as well as resources and information. And then we also talk about treatment and survivorship, understanding the different diagnoses and treatment side effects, the survivorship part of it, cancer with children, and so forth. Also with caregiver and family support. So it's not just the patient, but we also provide information and support for that caregiver, that family, what they're going through. Many times they're the ones navigating the whole system for this patient that we see and find out. We have cancer books, American Cancer Society books, as well as brochures, flyers, tear sheets, and so forth. That are available to you at your health system. And again, I'll let you know how you can access that. Again, understanding the health insurance, I kind of briefly talked about that, but the NCIC Center, that 1-800 number, these folks are well versed on knowing about health insurance and the different plans when it comes to cancer care for your patients. And they're also very well versed on trying to find that information if they can't. We had I know of 2 colleagues that I work with at ACS that live in the United States that went through cancer. And to this day, they still rave about the NCIC Center. They access that. They still have great friendships with that person that was helping them with that process. So I can't say enough about the staff at the NCIC Center. They know their stuff and they know how to help. We used to have a program. We still have this program. This is the personal health manager for patients and their families. In the past, prior to my arrival at ACS, this was more of a tangible physical document that came in a three-ring binder or an accordion system. Now we do just the sheer bulk of it and so forth, and it was kind of cumbersome to develop and to print and get out. We still have this available, this personal health manager system for the patients and their families. But it is accessible online, and there's the website there can be clicked on. We'll send this presentation out and so forth. When I also say by access online, it can be printed. So the pages of this document can be printed. Patient can then still handwrite that information on these sheets and put it in their own folder and document system that they have. Really well received prior to my showing up. The systems love this because the patients love this. They could put all their information and keep track of things. It was very organized for them. We have the Tender Loving Care program. This is for folks needing for mastectomy products or head coverings and so forth, from wigs to scarves to turbans to hats, whatever it might be. Our TLC program has all these types of products and so forth available for patients. I know here in Omaha, there's a number of systems that also have that as well. We just wanted to let that available. If those resources don't work for patients, this might be another option as well. So, and also for patients that you may have that are out state, so out of the Lincoln or the Omaha area, at our booth, we have a flyer that lists what we think are up to date for these mastectomy products, as well as wigs and head coverings as well, that can be accessed in the different cities around Nebraska. So if that's of interest to you, let me know. I can send you that flyer, or again, we have that at our booth. Also available is our screening guidelines in an informatic form or informational form. It's all listed through the website, and you can access that and search that by what cancer you're looking for, or what screening you're looking for as well. So transportation, we have a program called Road to Recovery. It is a volunteer program in which all our drivers are volunteers, and they are in the Omaha area. It's up and available right now in Lancaster, Douglas, and Sarpy counties. In these 2 areas here in the Douglas and Sarpy counties, we have about 15 to 20 drivers that are trained and ready to go and available to transport patients for free to and from their appointments or treatments or whatever that may be. So in the past, prior to the pandemic, This was all accessed through the NCIC Center, and then all the rides, from the first ride to the X number of rides down the road, this was all accessed through the 1-800 number in that NCIC Center. Now, the first setup and the referral is done through the NCIC Center and that 1-800 number. But all subsequent rides after that are done through a ride share app that can be set up from the patient or the caregiver. And then from that point on, the patient and caregiver set up the rides with the drivers. All they need is about 24 to 26 hours in advance notice. And hopefully those rides get picked up. But again, we have a number of drivers here in the Omaha area that are ready and willing to drive. And again, it really helps because it creates, it is much smoother, it's much more streamlined, takes out the middle person as far as setting up these rides. The patient and the driver can communicate through the rideshare app. So if something happens with a schedule problem where they need to bump it up quicker, or they need to cancel or reschedule, that can all be done through the app. And it's much, as I said, very streamlined and very helpful for the patient. If you're in an area that you're looking to access this or would like to try to start putting this in your community, please talk to me and we can start trying to set it up and trying to find volunteers in your area to participate in this road recovery program. So the Omaha Hope Lodge. We have a Hope Lodge here in Omaha. It is a lodge in which all lodging is free to that patient and a caregiver. It's not based on a sliding scale. It's not based on need or income need or whatnot. It's a place for this person, that cancer patient and caregiver, to stay free of charge from 1 to 2 nights to up to 9. With the longest stay we've had is over 9 months, and it could be 12 months if it needed to be. That person can stay there as long as they're needed to, as far as they're doing the treatment and appointments. So we have 32 rooms that are available. We're looking for the patients for the availability. It's for patients that are about 40 miles or farther away from the Omaha area. What I'm about to list here, there's some special circumstances. So if you have one of those one-offs, please, by all means, contact the Hope Lodge directly, and the folks there can help you with potentially some of those one-offs. But it's for patients 18 or older. We have had children that are 12 to 16 that have stayed there at one time or another. The patients must bring a caregiver that's at least 18 years of age or older. It's a minimum stay of 3 nights, but again, special circumstances, we can do 1 to 2 nights if needed, if a person's coming in for just an appointment or whatever it might be. And again, also special circumstances, if you may have a patient that can't have a caregiver there 100% of the time, and as long as we can get approval from you, that physician or that provider, we can potentially make that work as well. The amenities, it's a very supportive environment. There's proximity to all the treatment centers in the Omaha area. Again, if it's not close to, if it's at the med center, that patient can use the road recovery program to help them commute back and forth. Again, everything is free at the Hope Lodge. The only thing that we're asking for patients to do that we cannot provide is food. But we do provide kitchens. There's 8 kitchens within the Hope Lodge that each kitchen can host 4 rooms per kitchen. The one thing I really like saying, I'll talk about this picture here in a little bit. The great thing about the Omaha Hope Lodge is that it was opened in 2018. And so there's been a number of Hope Lodges that were open prior to ours. So our Hope Lodge here in Omaha has the benefit of all the previous Hope Lodges. And we're able to kind of, from that benefit, kind of create different combinations, or based on what the feedback was from the patients and the caregivers who stayed at other ones. And one of those is that the kitchen, you'll see that our kitchen is a very large kitchen, very open, very homey though. It's very nice, very clean, but it's very large, and it's really welcoming when you come in there. The second benefit is from the picture that you see there is the rooms. So one of the things that patients really wanted was to be able to separate the bed area, the sleeping area, from the lounge area. And that's what you see here in this picture is that that wall that separates the two can be, there's two sliding doors on either side. And so it can close off the sound from the lounge area and the patient can sleep and rest and so forth during that time. Also, free laundry rooms are available. There's free cleaning supplies that are available to clean the rooms. There's an outdoor reflection area, free laundry facilities, library, resource area. There is TV lounges on every floor, as well as a reflection area down on the main floor. And then there's an outdoor garden area as well. And these are just some of the pictures that go along with the Hope Lodge. You'll see part of the kitchen is the community pantry there on the top left-hand corner. That's food that's dry goods that are available to, and supplies that are available to the patients and their families for cooking. They're either been donated or they have been left behind by other patients and just donated from that aspect to the Hope Lodge. Again, outdoor seating area. There's the commons area, the two pictures of the commons area. And then there's a living room as well with the fireplace. The Hope Lodge is also available for volunteers from a Cooking with Hope aspect. We provide, if there's a group that you have that would like to provide a meal or whatnot, or whatever it might be, to the Hope Lodge patients, that can be arranged. Those groups can either cook the food there and serve it to the patients and their families, or they can buy food and bring it, whatever that may be. There's lots of options available. The next thing, just talking about with the Hope Lodge, is that the restrictions from the COVID standpoint have been lifted. So there's no more mask requirement, there's no more vaccine requirement, and there's no more testing requirement for patients or caregivers. So all of that has been lifted, and hopefully that can help, be a little bit more attractive to some of the patients that that was an issue with prior to. What we have here is then is the link and a QR code to the referral resource site. This takes you by clicking on going to the QR code or clicking on the link. It will take you to the referral resource site for the Omaha Hope Lodge. And it's a little hard to see with this picture, but on the far right are all the documents needed for that referral. And so you or your staff can click on that, either one of those links, such as the patient requirements or the actual referral form. You can click on it, type in the information there, click and send right from this website. So hopefully it kind of cuts down on some of the use and whatnot. I have flyers of this at my booth if that's of interest to you to have. If you want more of those, please email me and I'll be happy to send out that one sheeter that you can post in your stations or whatever it might be. This is just a real quick what the referral form would look like. This is also the referral form you would use for the Road to Recovery program as well. On that. I mentioned earlier about the educational materials. If you or your health system are needing or wanting materials from the American Cancer Society, we can make that work for you and your staff as free. Just again, contact me and I can send you a material order form, and you can order the materials that you need based on what's needed in your practice or your system. This is the ACS Cancer Facts and Figures. The left one is the actual Cancer Facts and Figures link. And the one on the right is the Cancer Prevention and Early Detection Facts and Figures for 2023. And so you can click on that and see updated information based on our state, from not only from the cancer side of things, but from the prevention and early detection side of things. ACS also provides prevention and screening projects, quality improvement projects. I'm recently finishing here with Methodist Health System in their 27 clinics in the eastern Nebraska, western Iowa area. in which we have set to try to increase HPV vaccination rates among their adolescents of 9 to 14 years of age. And we've done that for about 2.5, 3 years. And so we do projects like that, not only from HPV standpoint, but from a screening standpoint of breast cancer, lung cancer, cervical cancer, colorectal cancer. We can provide quality improvement projects that may help you with some screening with your system and your patient population. And again, if you're interested in that, please let me know. I'd be happy to talk more about that. Provide you some of the materials at least for you to look at and see what that's all about, what it all entails. Then we have the advocacy side of things with ACS is the ACS CAN, the Cancer Action Network. These are the folks that advocate for cancer patients and their families from a federal and local legislative level. So these are the folks that are going to the Capitol here in Nebraska, and they're going to the federal Capitol in Washington, D.C., and they're speaking with lawmakers on trying to increase legislation that helps cancer patients. Case in point, this last session here in Nebraska, we were able to pass a new definition on palliative care that is now on the books that makes what we feel is much easier for patients down the road to get services from a palliative care standpoint. So those are the types of things that we're working on and trying to help and increase access to care for cancer patients in our state as well as federally. And if you're interested in that information of joining or becoming an advocate, all that's listed there on the right for you. And that's what I have. So I just want to take this time to just kind of remind people what we have for your cancer patients and their families, what's available from a programs and services standpoint to support them. And if you have any questions, I'd be happy to take those now. All right. Thank you.